Welcome. This is Connie Delaney, and we welcome you to the National Center for Interprofessional Practice and Education webinar entitled Advancing Interprofessional Practice and Education Through New Knowledge, Update on the IPE Core Data Set. We're going to cover several topics today. Why an IPE Core Data Set? What are the elements and how are those elements gathered through surveys and health outcomes? We'll talk briefly about what's next and upcoming opportunities. Ask you to pause for a second and acknowledge, as we regularly do, our learning partners. Give many thanks to all of our advisors, program participants, Nexus Innovations Network, funders, and many stakeholders. Particularly, we highlight, of course, the network members, our National Advisory Council, NCBR Advisory Council, Scientific Review, and Knowledge Generation teams. What you can easily note in previous communications as well as today is that where we are today is a result of the significant contributions of many over the last several years. This includes advisors to early adopters. It includes all that have contributed to data, ideas, and recommendations. The resulting IPE core data set is a landmark contribution nationally that will serve to advance the field and is an accomplishment for which we can all take pride. I'd like to pause for a second and also highlight the knowledge generation team at the National Center, and particularly note the breadth of interprofessionality, expertise of these members that you see on on your slide right now. We will be hearing from David Radosevich later in this webinar as well. But again, a hearty, deep gratitude to the full work of the knowledge generation team. The National Center is committed, as you know, to a Nexus Vision, the intersection of practice and education. This results in improved outcomes. Moving forward, all new projects will have a defined nexus. Again, the nexus, the intersection of practice and education. You hear us frequently talk about and emphasize that the nexus is the center of its project. All projects within the nexus collect essential core data that will be meaningful for comparative effectiveness research. And as you see, the key emphasis since the inception of the National Center and our work together has been the triple aim. And of course, as the evolution of the quadruple aim has occurred, you will see that reflected in the core data set we shared today. Note the brief history of the IPE data collection. In a short, less than 6-year time period, you can see the expedited movement from a center that is established and engaged in extensive literature reviews to this point in time, 2018, when we actually are releasing the interprofessional practice and education core data set. What a celebration. What does the IPE core data set mean to your project? We suggest that all network members will be invited to continue their participation in the Nexus Innovations Network. So participation could include continuation of your existing project or establishment of a new project. This webinar today will help you frame how this may affect you, your current or your future projects. Why an IPE core data set? Essential core data enhances our collective understanding of interprofessional practice and education. The interprofessional practice and education, as you and I know, while young yet, will continue to mature and make significant contributions to our global understanding of best practice. Essential core comparable data provides the ability to advance our best practices and understanding. One might ask, what's in the IPE core data set? You'll note on this slide that it encompasses outcomes, both the education and the clinical learning environment. There's a focus on population health, provider well-being. You can see evidence of the quadruple aim here, patient experience, and of course, use of health services, that is, cost. Let's review for a moment the interprofessional learning continuum as the framework for the IPE core data set. The interprofessional learning continuum model was developed through a consensus report from the IOM. This report is now known as the National Academies of Medicine, measuring the impact of interprofessional education and collaborative practice. The model was developed by a committee. It was to include education to practice continuum, the broad array of learning, health, and system outcomes, and major enabling and interfering factors to evaluate outcomes. Through the National Center's work with network sites across the country, and most recently the 16 Accelerating Initiative grantees working in community-based clinical settings, the IOM model has become the National Center's working model to support interprofessional practice and education, implementation, and research. You will see aspects of this model represented throughout the rest of our discussion today. If you haven't already done so, we highly encourage you to go to the nexusipe.org and search Measuring the Impact. You will find the report and a webinar with Study Chair Malcolm Cox discussing the recommendations. The IPE core data set includes data about the Nexus. As well, it includes the education environment and the clinical environment. Together, these three pillars will support a more global understanding of what it is and what it isn't, and what isn't working to advance the field of interprofessional education and collaborative practice. So again, the three pillars: education, clinical practice, and the core nexus where they come together. You might wonder who contributes to the IPE core data set. As you can see from this slide, the surveys target various audiences. Project PIs and leaders are responsible for the education and clinical environment surveys, as well as the project proposal. Individual learners and members of the care delivery team are targeted with specific short surveys. And there is a brief 11-item survey for patients involved in the project delivery as the recipients of care by the interprofessional team. You can immediately see in looking at this slide that there's been a very focused effort to target and minimize the data gathering component of this work. This slide provides a summary of how the elements of the IPE core dataset map to both the interprofessional learning continuum, which we referenced just a bit ago, as well as the quadruple aim outcomes. Note, all decisions about the data to include in the essential core dataset have been driven by this alignment, the alignment of the IPLC model with the quadruple aim. Let's take a closer look at Nexus surveys. And you'll notice that the critical incidents survey is available now. The project proposal will be coming soon. There has been restructuring of the network onboarding process. Through our work with the network teams, we are learning that there is a lot more support that should be provided to teams in early stage to develop, design, and implement interprofessional education and practice initiatives. The center has responded. The center has developed a series of tools and resources called the Nexus Learning System. These are designed to support teams in thinking about all aspects of their interprofessional practice and education efforts. All aspects from identifying key stakeholders and available resources to working across practice and education to collaboratively design a compelling vision. We have also been working on the redesign of the actual onboarding process for teams that want to come into the network with their work. The newly designed project proposal is again modeled on the IOM framework. It is intended to support the design and implementation of a Nexus intervention, recognizing that most interventions are happening within the context of larger organizational efforts or transformation. The project proposal also serves as the foundation for working with network members around the essential core data set. Might I particularly draw your attention on this slide to the key elements of the Nexus project proposal. You'll see the red circle, and then you can immediately see how working on those key elements helps us work together to be able to collect and share the IPE core data set. Let's focus for a moment on the Nexus project proposal. You'll notice that this project proposal on this slide is an updated version of the work plan. The project proposal is designed to support the development of sustainable IPE initiatives. It's intended to promote the understanding that a specific IPE project that may be the focus of a Nexus project is often occurring within the context of a much larger IPE initiative. We ask you to focus for a moment on the elements of the Nexus project proposal guide, which is a consideration of key variables such as study design, the who's, learners, providers, and patients, the what's, educational, clinical intervention, when, the overall timeline, where it occurs, the setting, and why, project outcomes. We also particularly highlight the need for sustainability plans and as well the dissemination of results. Next, let's focus on the critical incident survey. We all know that critical incidences occur throughout life. They can be positively or negatively experienced and can be positively or negatively affect projects, or simply lead to a neutral change in a project's trajectory. Critical incidences, again, are not unusual in interprofessional education and interprofessional collaborative practice projects. They are not unusual as in any other observation or experience you and I have in life. You've probably experienced several. Based on the analysis of the contributions of so many in the network and what network members have shared verbally, we have defined the categories which you see represented on this slide. Again, these categories emerged out of the on-the-ground work that you have shared. Critical incident. To facilitate potential usefulness in solving practical problems, the critical incident technique outlines procedures for collecting observed incidences, having special significance, and meeting systematically defined criteria. So, critical incident. To be critical, an incident must occur in a situation where the purpose or intent of the act seems fairly clear to the observer and where its consequences are sufficiently definite to leave little doubt concerning its effects. And here we're quoting Flanagan's work, The Critical Incident Technique. And we again remind you, the critical incidences are a normal part of project implementation. We're just all committed to collecting when they occur and descriptions about them. So again, based on your work, critical incidences have now been categorized into the categories you see on this slide. And I might add, it takes only about 3 to 5 minutes to complete the survey. Note particularly that there is no limit on the number of times the survey can be completed per project. Watch your inbox. This new survey is now available in the NCDR, and we'll be sending you information about how to easily access it. Again, note the 6 key categories: project strategy, project data, money and resources, internal partners, external forces, as well as external partners. Why would we want to have the critical incidences reported? 2 big reasons. First of all, benefits to your project. Critical incidents provides a record of project changes that affect implementation, and it also informs understanding and analysis of project outcomes. Again, outcomes occurring within the context of a care delivery and educational intervention. Second, critical incidences benefits us nationally. It allows the National Center, in full partnership with you, to identify common issues and events affecting IPE and, most significantly, to together develop strategies to address these common issues or events. Moving on, let's take a closer look at the Nexus surveys under education. Again, you will see the timeline shared here. The survey for educational environment is coming very soon, and the ICAS, the implementation for testing, is already in place. Let's take a closer look at Interprofessional Education Learning Environment Survey. The purpose of this survey is to assess the level of institutional investment and support for interprofessional education at a project-affiliated educational institution. For each major education partner, they are asked to complete the survey annually. This is important so that nuances in the curriculum, the location, and the environment that affect IPE can be captured. The project PI, or an education lead for each major educational partner, is best suited to complete this short 25-item survey. The individual completing the survey should be familiar with the institution's interprofessional curricula, its learners, and how the interprofessional curriculum or curricula aligns with institutional goals. The Educational Learning Environment Survey is parallel to a survey that focuses on the clinical learning environment. And now I ask you to welcome our colleague, David Radosevich, who will continue to explore the additional surveys. David?
Yeah, thanks, Connie, very much. Actually, this it's interesting to look at because the actual surveys themselves, there are 2 sides that I'm going to deal with for this presentation. One has to do with the education side, and the other has to do with the clinical practice side. In either case, it's not the individual sites that are filling out the surveys as such, but it's the individual participants that are filling these out. So that on the education side, it's the learners, and on the clinical practice side, it's the patients that are affected by the actual implementation of the intervention itself. On the education side, we've actually adopted the use of something called the ICAS survey. And many of you, I'm sure, have already had some contact with this. And this is going to be our core data for the National Center's Nexus Innovation Network. And this means essentially that all projects that are involved in the network will be using this tool to collect information from the learners. So learners in this case could either be students, or it could be even practicing professionals. And the core ICAS itself actually originally consists of 20 items. And I won't go into a lot of details in terms of how these are actually being collected, but I know our own experience here at the University of Minnesota actually used something called a retrospective pretest, post-test design, where the individual students who are participating in the IPE courses or our FIPSI course essentially complete the course at one point in time. There's 2 additional items that have been added to the ICAS. Both of these items actually involve something called propensity measure and something called an endorsement measure, which are included and which we're asking for sites to collect as part of the core data set. As this relates to the National Center, has adopted the ICAS as a standardized measure of self-report to assess changes in interprofessional collaboration competencies before and after the IPE interventions. So this tool is being adopted broadly and provides an important opportunity to make apples-to-apples comparison across sites that are participating nationally or even internationally for that matter. The advantage of using the ICAS is it's got good psychometric properties. It has been well investigated. I know we've done a number of studies here, at least at the University of Minnesota. There's been work done at Doug Archibald up in Canada as well with this measure. It's been well established. It has good reliability. It has good validity for use at least within health professional programs, and probably even as equally important is the fact that it has good sensitivity or responsiveness for detecting changes in the benefits of IPE learning activities. So there is and there has been developed something called a National Center User Manual for the ICAS, and this is a user manual that actually details information about the methods for its use and scoring, as well as recommended covariates and data dictionary that would support analysis both within the National Center as well as locally within the sites that are using the instrument. So in response to feedback about the challenges of learner access to the NCDR, the National Center has actually developed a one-step portal for learners to access the ICAS survey, which has been great. The project PIs themselves can actually provide a list of learners, email addresses, and those learners would receive an automated email from the National Center with a link to access the survey. And this would actually be through the NCDR website. And so reports would be immediately available to project PIs. Data would be essentially stored, and it's very, very positive development, I would say, from my vantage point. And so as an alternative, sites could be and would be able to upload data through locally managed databases, and I know there are some sites that actually have their own homegrown systems. These would be available to upload through the data dictionaries provided in these instances. Guidance to the user manual relates to both methods as well as covariates that are necessary, and the data dictionary, which is very important. So I think this is a great development. So what are the benefits of this online ICAS access? Well, I mean, there's certainly some that are listed here, and then a few others that I've actually listed that aren't shown here on the slide. But the benefits include actually the access to a HIPAA-compliant server for data collection, which is great. Increased data integrity through electronic data upload in standard data dictionary. Real-time access to standardized reports with summary data provided. Immediate access to download de-identified data for additional analysis. Opportunities to compare learning data to other sites. This also actually allows sites to actually reduce or minimize the amount of student tracking hassles that emerge if you're going to try to roll something yourself locally, as well as minimizing attrition bias by using retrospective pretest post-test design, which I think is probably a very important consideration, especially given the fact that a lot of time and energy goes into actually trying to track and keep track of students and the timing of implementation. So we should look right now, actually, at February of this year would probably be available for implementation testing, at least for the ICAS access, and just a matter of contacting the Nexus Net at umn.edu and want to be considered part of the pilot. And I think we have at least one site that I'm aware of right now. I know that's going to be participating in this. Sorry. Now, closer look at the other side of the Nexus model, if you will. And as shown here on the slide, there's at least the clinical environment survey is remains in development. The patient outcomes are probably the side that's probably been most, widely developed. I don't know, Connie, did you want to say something about maybe the interpersonal or interprofessional clinical learning environment survey? Yes, I've got you on there.
Yes, David, I will, and I know we're going to say more also about patient outcomes. As I do that, I also want to highlight your invitation and emphasize your invitation for those that want to be engaged in the ICAS implementation testing opportunity. As David said, let's focus again on the right side of that of the diagram with the Nexus Survey, Interprofessional Clinical Learning Environment Survey. You're seeing a similarity here between the Education Learning Environment Survey, now the Clinical Learning Environment Survey. The Clinical Learning Environment Survey is designed to assess characteristics of the clinical learning environment as it relates to fostering interprofessional practice and collaboration among learners across the curriculum. A few comments about, again, you'll see a continuing thread of emphasis, and that is a short 29-item survey. It's completed annually by the lead at each site, and of course the data are submitted through the National Center Data Repository. It's important to highlight that the person responsible for completing the survey should be familiar with all aspects of the clinical environment where the project's occurring. To complete some items on this survey, that responsible person may need to consult with clinical administrators. Now I'm going to share this back to you, David, to talk more about team perception of the Interprofessional Learning Environment Survey.
Yeah, a little bit of a team tag here, but the team perception actually completes the right side of our diagram that Connie shared with us earlier. And this really has to do with the survey containing assessing the team's perception of the clinical learning environment and the extent to which it fosters interprofessional and collaborative practice among learners across the continuum. And in its present iteration, it includes 5-item survey, which are completed by staff and educators, in this case, and providers in the clinical environment. And it, again, is easily accessible via an emailed link, very similar to the ICAS. And it's completed basically by the Nexus team, and the plans are right now that this would be completed annually, so at the beginning of the project and then annually thereafter. Now, the final piece of the right side of the diagram that Connie had mentioned earlier actually concerns the IPE outcomes variables, and these actually focus on principally the triple aim, and the triple aim elements that we're looking at have to do with the population health, patient experience, and cost. And so the current version, the version right now, is that we're looking at 11 items. These are standard measures that have been used in a variety of settings, and in fact, if you wanted to trace the lineage and the questions that have been involved and developed, actually most of these actually date back to the early 1980s to late 1970s, because they're actually part of something called the health insurance experiment that was conducted by the RAND Corporation. And so they include measures such as general health measures. They include measures having to do with satisfaction, some of the old lineage back then. These are data that would be submitted to the National Center Data Repository, again, at the beginning of the project and at the end of the project. And they're very, very simple questions, well standardized, well investigated. They've actually been used as part of the National Health Interview Survey, the NHANES, and then also currently by AHRQ. So a lot of these measures have gotten a very, very good lineage. We also are adopting something called which is slightly different than what we had done before, something called an optional expanded outcomes measures. And these measures actually focus specifically on the areas that are the focus of the interventions that sites are actually implementing. And they would include measures such as the CAP survey, which might be very appropriate if the the outcome that we're looking at has to do with, let's say, something to do with satisfaction or the overall patient experience, for example. If an intervention includes, let's say, focusing on patient measures or patient population health measures, it may include something like the SF-36, which could be considered a standard or an outcomes, expanded outcome measure. And all of these measures, again, are adopted and have been adapted from ongoing research and investigations through the CDC, AHRQ, CAPS, and ECHO, for example, which is another CAPS-like survey that's actually been used pretty widely by AHRQ. So as you probably know, there's a whole variety of versions of CAPS surveys that are out there. Our recommendations right now is that for sites that elect to expand their measurement set to include CAPS measure, we would like to have them choose the measure which is optional, that is more specific to the type of intervention that they're dealing with. But to recognize that all the CAPS measures have a common stem and a common set of core questions, which are the ones that are being adopted as far as the core set that are being used by the National Center. And currently, as far as cost measures right now are at least at the very least are adopted from the National Health Interview Survey and also from the NHANES, but also sites could elect to collect information using administrative codes, but in which case they'd only provide summary data to the National Center having to do with primary care, healthcare visits, hospitalizations, and emergency department usage. So I'll transition now to Connie for the last part of our WebEx here today, and go on. Thank you, Connie.
Thank you, David. And in addition to the essential core data elements that you outlined, thank you for summarizing optional expanded outcomes measures, because we do know that many of our partners are either engaged or committed to that extended space. So let's revisit a question that we posed early on in this presentation. What does this mean for your project? All network members will be invited to continue their participation in the Nexus Innovations Network. Participation could include continuation of an existing project or establishment of a new project. So let's look at what each one of those might mean. If you have a current project, what would be required is a brief Nexus project update to understand the current status and to include a commitment to collect the IPE for dataset. What about your participation if it includes establishing a new project? In this case, we would ask the Nexus project proposal be completed, work in full consultation with the National Center to establish clarity and doability, basically, and like current projects, a commitment to collect the IPE core data set. There is a timeline. Let's share what that looks like. What we've outlined is, frankly, the next 6 months. This month, the Critical Incident Survey, the revised one, is released. In February, the implementation testing of the online ICAS functionality and data uploads will occur. And again, David, thank you for the invitation for engagement in those activities of implementation testing. What we're looking at in the spring of 2018 is to pilot test the Nexus project proposal, and by the summer of 2018, launch the IPE core data set in its fullness. So, where have we been? We've tried to summarize. We've provided a both rigorous and doable timeline. And now let's transition to sharing a few experiences that we invite you to participate in this spring. Interprofessional by design, from return on investment to integrated care. What you need to know to advance team-based care. We invite you to participate in this course over 3 days. It's very active, it's practical. It's an opportunity for participants to learn and practice strategies and use tools for high-performance teamwork in care coordination and integrated care. The invitation is boldly put forward to you. Next, you'll see on this slide the offering of interprofessional big data, harnessing the power and opportunity to support interprofessional solutions. This workshop has been developed in response to the National Center members, and it particularly responds to what the center has heard from partners. It includes hands-on informatics and a big data workshop. It is meant to provide a laboratory to address the key issues that attendees are facing. It's about listening and addressing the key issues. The workshop will also include teaching key concepts, highlight exemplars, and provide group consultations and customization of work sessions to address, again, the questions that are spontaneously brought forward by the attendees. We welcome you to provide space in your lives for April 4 to 5 for this conference to be held in Minneapolis. And, of course, we're looking forward to the Nexus Summit 2018. Creating interprofessional practice and education, creating results, interprofessional vision to action. Again, note the focus of the summit. Ignite, or in some cases, recharge your creativity. There will be featured keynotes that will inspire us to new thinking, linked also to real-world workshops that deliver practical skills. The opportunity for peer exchanges at the Nexus Fair is exceptional. The opportunity for this networking, both with established and new connections, is robust, and the interactive conversation cafes also help us together tackle the most challenging topics facing this emerging field. As we conclude this webinar, we invite you always to come and visit the phenomenally robust web presence and social media presence of the National Center for Interprofessional Practice and Education. Notice Facebook, Twitter, and LinkedIn, as well, again, as our robust website. Thank you for your participation in this webinar, and we look forward to continuing to listen, partner, and find bold solutions to advancing the interprofessional field of interprofessional practice and education.
Thank you, Beth.
Thank you.